Go.
All right, I've just entered the hospital. Whenever we enter the hospital for the first time, I perform a full hand wash with soap and water. So I've gone ahead and done that. I've checked my orders and seen that my patient has an order for an NG2 placement. So I'm going to go ahead and gather the supplies necessary to do that. I'm going to get my Salem sump kit, a 60 milliliter syringe, an emesis basin, a washcloth, a pH test kit, some saline solution, a tongue depressor, and I think that's everything. So I've got all my supplies. I'm going to go ahead and enter the patient's room. Knock, knock, knock. Hi there, my name's Jay. I'm a student nurse. I'm going to be helping out your nurse today. And hygiene. Can you verify your name and date of birth, please? All right, I'm checking that against the MORA. Do you have any medication allergies? All right, good deal. Well, the reason I'm here is we're going to be placing an NG tube into your stomach to help get some of the contents out in order to help your digestion because of the blockage in your abdomen, all right? All right. I'm going to go ahead and raise the bed to a safe working height. And then I'm going to go ahead and lay the patient flat in order to conduct an abdominal assessment. So, get them pretty flat. I'm going to go ahead and raise your gown. I'm going to be listening to your abdomen, okay? Okay, so I'm not really hearing any bowel sounds. That's indicative of the obstruction, which is why we're performing this procedure. I'm going to go ahead and auscultate the lungs as well. Make sure they're nice and clear. And while I'm doing that, I'm also checking the patient's pulse ox. Make sure that they're well oxygen saturated. Okay, now that that's done, to assess the patient, I'm just going to check their nares and gag reflex as well. I'm going to raise them up into the Fowler's position in order to perform the procedure. I'm going to perform hand hygiene, put on gloves because I'm going to be touching the patient's mouth. I'm going to go ahead and assess the patency of the nares. I don't have a pen light, but if I had a pen light, my trusty assistant here has a pen light. I'm checking for blockages. I'm going to close each nair, have them breathe through, make sure it's patent, make sure there's good airflow, there's no obstruction. That's great. Now I'm going to go ahead and assess the gag reflex. So just lightly, that's good, that can go. So we've concluded the assessment. Patient has a need for this procedure and is able to do it. So I'm going to go ahead and prepare the patient for the procedure by providing them with a washcloth in case they do vomit or anything like that, and an emesis basin. There we go. Okay, I'm also going to provide the patient with a glass of water. If it's not contraindicated, they can sip water as I'm inserting the tube. It might help it go down a little bit easier. So there you go, Mr. Smith. You can have that water if you want some. Okay, I'm going to go ahead and unpack my saline soap. And the first thing I'm going to do, remove the connector, and then draw up 20 to 30 mils of sterile solution and just flush it through the saline sump in order to make sure that there are no blockages in the line. Just double checking that. So that's all good. Now I'm going to go ahead and measure the tubing. So I'm going to get some tape ready for marking the tubing. I'm going to remove my gloves actually because wrestling with tape and gloves is terrible. For some more hand hygiene just to be safe. Alright, so I've got my tape. That's ready for me. I'm going to go ahead and measure from the nair to the top of the mandible and then down to the xiphoid process. Now on this mannequin we can't insert the tube any deeper really than about 30 centimeters, or millimeters, centimeters. But in real life I would measure another 10 centimeters past the xiphoid process in order to approximate the depth of the stomach. But here I'm just going to mark what the xiphoid process is. Now that the tube is appropriately marked, I'm going to go ahead and don some new gloves. I'm going to dip my tube in about 3 or 4 inches of lubricant. Bring it on over to the patient. I'm going to have the patient hyperextend his head as I insert up to about the back of the nasopharynx, and then I'm going to have him lean forward as I further insert the tube down the esophagus. Kind of guiding it, and he can sip his water as we go. It's pretty unpleasant, but we're getting it down there. Alright, I've now gotten the tube to the tape, so I'm going to go ahead and hold it there while I just grab a quick piece of tape. To secure it to the nose. Okay, so it's secured. I'm going to go ahead, before I fully secure it, I'm going to go ahead and aspirate, check the pH, make sure we're in approximately the right position. So I'm going to aspirate 20 to 30 milliliters of stomach fluid. Looks good. I'm going to go ahead and put that in here, grab a pH test strip. Test that, checking it against the color chart. I can see that the stomach aspirant is about 2 on the pH scale, which is great. That's what it's supposed to be. So now I am reasonably certain that the patient has the tube inserted in the right place. So I'm going to go ahead and auscultate the stomach as I insert some air into it in order to further assess and check. I'm just going to lift your gown up here, sir. And I'm auscultating the stomach as I insert air. And indeed, I can hear that there's air in the stomach. I'm also checking the lungs, make sure they still sound clear, and checking his pulse ox to make sure that hasn't gone down, which would indicate some kind of an obstruction of the respiratory system. But we're all good. So now, because I'm feeling pretty confident that this tube is placed in the right place, I'm going to go ahead and get him fully taped up. On the cheek. and then on the gown as well. And now I would send this patient down to radiology. They're going to perform a chest x-ray, make sure that the tube is indeed placed correctly. They've come back, radiologist has confirmed that it's placed correctly. So now I'm just going to perform one last check to make sure it hasn't moved during transport at all. I'm going to insert another 20 or 30 mils of air. And again, auscultate the stomach, listening for that air to make sure that we still have good placement. Beautiful. Okay, and once again, just to be safe, assessing lung sounds, checking pulse ox. Doesn't seem to have any movement during transport back, so I'm feeling pretty good about it. So now I'm going to go ahead and connect the tube to the suction as ordered. So I got my connect piece here. Got my suction. The doctor has ordered 100 millimeters of mercury continuous suction, so I'm going to go ahead and set that. That's good. Checking that. I'm assessing the patient for comfort. How are you feeling? I'm seeing that suction is flowing correctly. So I think we're all set there. If the patient doesn't need anything else at this point, I'm going to make sure they're comfortable. I'm going to lower the bed back to a safe position. At this point, I could offer to perform oral hygiene for the patient, get rid of some of that nasty taste in their mouth from the procedure. I'm going to clean up all my supplies, perform hand hygiene, and then after I leave, I would make sure the patient does know where his call line is in case he needs anything while I'm gone. All right, go ahead and step out. I'm going to document that an NG tube was inserted. It was inserted to a depth of 55 centimeters. The aspirin tested within the range for stomach acid. It was about a 2. It was confirmed by the radiologist to be placed correctly. The patient tolerated the procedure well, no drop in oxygen, no abnormal amount of discomfort or pain, and the NG tube is now set at the ordered suctioning of 100 millimeters of mercury.